All right, there we go. Sorry about that, guys. We are 2 minutes behind. We're having some technical difficulties on my end, not my team's end. So we're trying to figure this out. So sorry about that. This is not in the original scheduled post. So we'll try to fix that for next time. So thank you all for joining me. And again, I'll just keep saying this throughout. If you are, I can't see who's watching. So if you're in the comments, I can see the comments. So just post that you're watching in the comments. Give me a emoji, how you're feeling today, that kind of thing. Sorry, turn that fan off. Welcome back. It is a week since I've talked to you all, some of you anyway. So welcome back. Couple campaign updates. We are in the process of taking orders for lawn signs. Hang on one second. I'm texting my team member back here. I'm not on the schedule. Okay, so we are taking orders for lawn signs. They will, hey Lisa, yay! They will look similar to this. So if you want one, go to the website and there is a section on the contact page and I believe a section on the volunteer page as well that you can get your order in for those. Yeah, so get those orders in. We'll get those going at some point this summer, I think. Haven't decided on the date to order those yet, but we will just get as many orders as we can so we can make one big bulk order from our union printer. Yeah, so that's the update there. We're still, on the same, making calls and texts train. So basically, we're just trying to spread the word at this point. Engage everyone, talk to our community members and see how everyone's doing, spread the word about the campaign, spread the word about these events. So if you would like to get involved, we can tailor a list to you, to your neighborhood. You can call your friends and family if you want. We can give you a script. You can go freestyle, whatever works for you. We will make it work with us, with our team strategy as well. So if you're interested in that, please let us know. You can go to the website. You can post it here, and one of my team members will take a note of it and we'll get back to you on that. So thank you all to have been helping us with that. This is, as you know, a huge district. This is an open seat. There's a lot going on. So we can't do it alone. We need every single person involved. So I really, really appreciate all of you helping out with that. It's been a lot of fun, let me tell you. And we are still looking into, and probably for not next week, but the week after, the split screen kind of Zoom Facebook Live. So I can have special guests on here. So it's not just me talking at you guys for an hour. So, hey, Nancy. The few folks that have just joined, let me know you're watching in the comments and I'll give you a little shout out. All right, it's a beautiful day out there now. It wasn't this morning, so I hope you guys are outside or taking a break from being outside safely and watching us here. So thank you. So let's give a quick COVID-19 update. We are now as a state up to 20,573 confirmed cases, 869 deaths, unfortunately. And in Carver County, we're up to 161 cases, and I believe we're at 2 or 3 deaths now. I can't quite remember. That's up from 113 last week. So we're still in the increase. We're still in the uptick. We have got to be really, really careful in everything that you're doing. My family, for example, has not changed really anything that we're doing, regardless of the change in the stay-at-home order and the Stay Safe Minnesota order, which I'll go over in a second. We are still being extremely cautious. I still live with 2 people who are very autoimmune compromised, and just, so we're taking care to not spread things if we're carrying them and keeping our community safe. So keep doing what you're doing there. So for this, the Stay Safe Minnesota order, that's very comprehensive and detailed. If you need more specific details, you can go to mn.gov/COVID-19. That's going to give you all the updates, all the numbers, all the restrictions, all the phone numbers you can call if you have questions. And if you have any questions you don't want to ask them, you can ask me and I can get you the answer, hopefully. So they are encouraging masking. This is a question that we actually got a lot of in the past week or so, how we feel about masking. And I have several masks. My whole family does. That's a necessity. I mean, you have to. And you don't have to by law, but you have to, because think of it this way. Think of it like it's the nicest thing that you could do. It's a simple, simple act of kindness. If it makes someone else even feel better, if you don't even believe in the science of it, if it makes someone else feel better for you to be wearing a mask, that's an act of kindness. That's super easy. Throw it on, go to the store, come back, take it off. Um, it does make a huge difference scientifically. There's study after study that says it does make a difference. There's been some extreme politicization of it. It's turning into, we're not going to wear a mask because, whatever elected official says it makes you look silly or it doesn't make a difference. It's really unfortunate that it's turned into that. I encourage you all to ignore the politics of wearing a mask and just do it. It's super easy. And it makes other people feel better. So why not? Act of kindness. There are several stores in the area that are open or will be reopening with a mask requirement. I know some restaurants are in the area that will have their workers are all going to be in masks, and they are encouraging patrons to wear masks as well. A little bit difficult while you're eating and drinking, but as long as you're coming and going, in between, bites and drinks, you can wear one. So you are under the Stay Safe Minnesota order. You are still required to telework if you can. Luckily, the state legislature has allowed me to do that, so I've been home this whole time, and there's no, immediate need to go into the state office building. So I'm really fortunate we've been able to do that. So I hope that most of you are too. So they are limiting now, expanding rather, gatherings up to 10 people or less. And of course, still maintaining those guidelines, 6 feet away, washing your hands, not touching your face, wearing a mask, that kind of thing. They are also allowing drive-in gatherings with the MDH guidelines. So that's exciting. I've seen actually a good friend of mine that works for a production company just built a drive-in theater in another city, in another district. So folks could enjoy drive-in movies, kind of that like retro fun thing to do. So yeah, I picture that coming up a lot here. And I know we've talked with several places of worship and churches and that kind of thing that are planning their expanded drive-in services. All of that has to be really, still maintaining those MDH guidelines, 6 feet apart. You guys know the drill. So retail stores are able to open now with a max of 50% capacity. That's fire code, 50% capacity allowed in the stores. They have to have a plan. So if you have a small business or a small business owner that needs a plan, the DEED website and the governor's website both have kind of templates for how to get those plans in place. Super easy to follow, and they're really willing to help you figure that out. So please spread the word about that as well. Restaurants are able to open with outdoor dining. So that's up to 50 people maximum. Still, 6 feet apart, maintaining the mask requirement, that kind of thing. That's going to be tricky for some businesses here and restaurants here that don't have outdoor seating. So I know a lot of the cities, city council members and city managers are working with those restaurants to maybe close down a street, maybe expand into a parking lot. There's going to be some flexibility with those laws in order to accommodate those 6 feet outdoor limits. Personal services, so things like hairstylists, nail artists, nail technicians, tattoo artists, they can reopen with 25% capacity, and they are required to wear masks as well as the patrons are. I know some of the salon owners that I've spoken with here have said that they're already, they've got masks and gloves, and they're going to take temperatures at the door and that kind of thing. So they're ready for this, which is great. Still no gyms, theaters, large gatherings. We're going to miss our concerts. Really, really bummed about the correct decision to cancel the state fair this year. It's going to be that much better next year, so look forward to that. But still no, large gatherings over the summer. Outdoor youth sports, there's some really specific limitations on there. I don't want to read them all off for you guys here. It'll take the whole time. So there's no contact sports are allowed if there's groups of 10 or less, and masking is encouraged. DNR is slowly phasing open their camping grounds. been in campaign mode too much. They're campgrounds. So I know like my dad was looking the other day for a state campground to go fishing near and take his RV with him. And they were booked up until the end of July. So good luck finding that. But there may be some available. So keep searching. And that's going to be really, all the sanitary requirements and MDH requirements are going to be in place there as well. And we talked about the places of worship. So it was really, as a person who lives with someone with an autoimmune disorder, it was really difficult to hear the governor's announcement and hear we have to see what happens. That's tough to hear because see what happens in my mind means people will die and we have to see how many will die. So as much as it's good news that we're going to try to help these small businesses, we have to keep in mind that there is a pandemic. Nothing has changed about that because we've all gotten sick of quarantine. Nothing has changed about that because we're opening things up in phases. You still have to be extremely careful. Wear your mask, wash your hands. Don't be within 6 feet of each other. No contact, that kind of thing. We're going to see a spike. We're not up to the peak of this disease here, to the peak of the outbreak here in Minnesota, and definitely not in Carver County. We've kept these numbers really small for a reason because we're doing what we're supposed to be doing. So I encourage everyone to keep doing that and keep your fellow, community members in mind, folks that are really susceptible to this illness. You may be carrying it and you don't know. So just keep the course. Keep your mask on. Keep doing what you're doing. And I guess we'll see what happens. Unfortunately, it breaks my heart to know that there are going to be families in our community grieving because someone died as a result of this illness. And if it can be prevented in any way, shape, or form, personally, I encourage you to do that. All right, a capital update. I've gotten some questions about there's, I believe, some messaging that's out there that is not accurate. Kind of the leading by fear thing that I always talk about, that the governor can just extend the peacetime emergency and that extends his powers on his own. He can just make that decision. And it's this whole, tyrannical government argument that has messaging wise in the past been proven to work. So that's what certain politicians and groups of people are choosing to do right now. Say, Walz is this, tyrannical governor and he's going to make all these, he's going to rule by his own accord. Knowing him personally, I can tell you that's not true. That's really silly. He's a very team-oriented kind of person. He's been really responsive and listening to the legislators that I've worked with, my fellow staff members and coworkers within the House and the Senate. This is not a position that he or anyone really would want to be in. I mean, I'm glad it's not me trying to make these decisions. So to clarify, a special session has to be called and he has to get a simple majority again in order to extend those powers. Period, end of story. So he is not officially called a special session yet. I believe they will on June 12th. That's the rumor that's going around. Again, nothing official has been called yet to my knowledge. And I'm a staffer, so I think I would have heard it. But, correct me if I'm wrong if anyone's heard otherwise. But I don't see a simple majority being easily won at this point. Or easily achieved. So I think the special session will be mostly about bonding, the bonding bill that failed that I talked about on my town hall last week. And it'll be, there's actually I wrote down a couple of things that it will probably be, there's no plan for the $1.87 billion of the federal dollars that are coming to the state. There's not a specific plan on how to get those to different cities and counties and groups and direct them to places they need to be. So we need to put that plan in place as a legislature. And I believe Walz has made that statement that we want and I know Myron Franz, the commissioner of the MMB commissioner, has said we want it to be a collaborative effort. So I believe that will happen. We got a couple questions again about broadband, and I love that that's on people's minds because I'm so passionate about it and it needs to happen. So part of that funding that I've talked about previously that the House voted on to allow, I think it was $200 million for expansion of broadband into rural areas, got wrapped up in the education policy bill. And that died because the Senate didn't act quickly enough on it. And they had some pretty significant disagreements that they just couldn't come to an agreement on. So we're still looking for more funding and more expansion of broadband. The reason it was in the education policy bill, I mean, we've of course would love to be it as a standalone, but we just didn't have the time and capacity to get that done. Was it has so much to do with distance learning. You know, all these kids are home. You know, school's almost out. Parents, hang in there. You're almost there. But schools, you know, all these students are doing distance learning right now, and to have a kid in a rural area, a farm kid that can't get broadband, significant decent amount of Wi-Fi to attend their classes is now having to be driven in and sit outside of a business in the middle of downtown in order to get any service. I know one of the chairs that I work for lives in a very rural area and can't even take phone calls, consistently at his house, and definitely can't do any online stuff. So he has to drive, 20 minutes into town and sit outside of a business and run these meetings. But, it's, and working at the small business that I worked at, just down the street here, when there was only 5 businesses or homes on the street, so we couldn't get a broadband update in decades because they didn't see the significant need. The aggravation that had on those small businesses and families there is just aggravated now 10 times over, because all of us are in the same position where we're all having to work from home and distance learning and that kind of thing. So now more than ever, we need this broadband, state border-to-border broadband, at least a little bit of funding. I mean, that would be great. So when I get to the legislature, that is definitely something I will be pursuing for our community. It's very necessary. So hopefully we can get a little bit of that done in special session as well. One thing that was left on the table as well is the state worker contracts. Those are contracts that were already negotiated and settled between about 50,000 state employees, so about 11 unions and 50,000 state employees. And the state negotiated, settled, and the state legislature just had to ratify them. The House did, the Senate did not, for whatever reason. So that needs to get back on the table and be discussed and ratified. And again, the bonding bill is the big thing. We need, shovels in the ground, people getting back to work, and these infrastructure upgrades need to happen. We're going to be facing some pretty significant costs down the road if we choose to not fund some of these projects. So definitely needs to happen, and I'm hoping that will get done during that special session. My job will change a little bit. I was a session-only CA, so committee administrator. I think the plan is to have me go back to being a committee legislative assistant, so I'll be working less with committees and more with members. So I'll keep you guys updated on that. I'll still have access to all the same people that I do now. So if there's questions, I can certainly get those answered. All right, so that's the Capitol update. Let's swap to our positive news section, which I still have not thought of a good name for. So if you guys have a good name for my positive news section, let me know in the comments. And again, for those of you who are just joining, please let me know in the comments that you're watching so I know you're here. Otherwise, I can't see you. So Watertown my home city, made the news. We made the news, Star Tribune, I think it was on KTSP, Kier 11, one of those two. The Watertown Chamber of Commerce gave out chamber checks to every resident. I live in Watertown Township, so I didn't personally get one. My family didn't get one. But these $60 chamber checks went out to Watertown residents, and those were redeemable only at Watertown businesses. It's a genius idea. And, $60 doesn't seem like a lot, but if you're getting every resident in Watertown to go spend this money at, whatever business in Watertown they want to, that is huge. That's a huge impact that it has on bringing the community together and supporting our small business community. So I'm so proud of them for doing that. That's just the greatest thing. And they got some recognition from it, deservedly so. The Smiling Olive in Chaska I just read a couple posts from a woman that is selling masks there. All kinds of different ones, like feminine ones, masculine ones, sports ones, kids ones, whatever. They're all at Smiling Olive, which is another great small business. I personally have not talked with the owner, so they're not endorsing me by any means, but I just want to kind of give them a shout out. The woman that's making them and stocking them there is also using part of the proceeds to donate masks. So she's donated about 1,400 masks to frontline workers throughout this process. So great job. That's another, great aspect of this community that we're all coming together and pitching in and doing our part and supporting local businesses and our frontline workers as well. So thank you. June 5th. I'm so excited about this. My alma mater, Chaska High School, on June 5th is doing a like graduation ceremony. Not a ceremony, but they're calling it Make Some Noise. So they're going to do, I think it's 5:45 p.m. on June 5th. They're going to be people outside making noise. They're going to do like the sirens, the tornado sirens, and all that kind of stuff, making some noise. And then there's going to be a driving parade. And to my knowledge, they're still working out the route for that, but I will let you know for that. So if you live in Chaska and you live near any of the routes, go outside, make some noise at 5:45. It's just celebrating the graduating seniors because they can't have an actual ceremony. So I'm just so thrilled to see that. So congrats to everyone who is graduating, both from high school and college this year, and not having your graduation ceremony. I have had three. I did not like any of them, but it's still a big, significant, event. So at least you get this, and I'm sure there's other, opportunities to celebrate your graduation and your hard work that's paid off. So all right, last update for the positive corner is there's an 11-year-old boy that's going to play taps on his bugle in Victoria tomorrow. And I can't remember what time. I think it's 3. It's just the cutest idea that, we can celebrate Memorial Day in a very safe outdoor way. So if you are planning to attend this miniature concert, please wear your mask and stay 6 feet away from others. But congrats to that 11-year-old kid that had that idea. That's phenomenal. It's so cute. All right, so I'll address a couple questions and then we're going to move into our topic for the day, which is mental health. So we talked about the broadband, we talked about the masks. I also got a question to include either my brother or my parents or my dog in one of these videos. My brother and my dad just went fishing and my mom's super camera shy, so we're not going to do that, but I'll bring my dog in at the end because he's the cutest and I'll show him off, sure. Got another question about term limits, which is really an interesting topic to me. Before I worked for Congresswoman Betty McCollum, I was so gung-ho on board. Yes, there needs to be term limits for every office. So when I worked for Betty, she really convinced me that that is not the case. While I agree with the term limits that are in place currently, I don't believe in adding any more. I see the argument. I understand. I also, on the contrary, on the other hand, see the value added for having like a veteran elected official, so to speak. So, for example, 2 years ago, last cycle, our only kind of veteran Democratic members of Congress were Betty McCollum and Colin Peterson. Our only Republican was Tom Emmer, my congressman. That makes a huge difference for all those newbies that come in because they already have this relationship with their delegation. They can lean on them for support. They can lean on them for kind of learning the ropes and seeing how things work, and having those relationships that the kind of veteran electeds have already established be beneficial to the newbies too. That the other thing that really sealed the deal in my mind was having a chair, having a gavel. So even in the State House, I work for 2 chairs that have been there for a while. Both of them were new chairs, had never been chairs before, but they'd been in the legislature for a while. There was another representative who just retired this year after, I believe, like 40-some years. His name is Representative Lyndon Carlson from St. Paul. And I can't tell you how many times both of my chairs, me, my coworkers, everybody stopped Lynn in the hall, Representative Carlson in the hall, and asked him a question about process, about, how does this bill go from here to here? What's a good tactic for this? What's a good strategy for this? Who do I need to talk to for this? Having that wealth of knowledge in the legislature is huge. It's so helpful. You never want to see folks get kind of stale and stagnant when they're an elected official. If that's the case, it's up to their electorate to vote them out. So to me, elections are term limits. I completely understand the other argument of that. I know that this is not a super popular opinion on our side of the aisle here, but elections are term limits for me. So good question. Thank you for that. There was a few questions also about cities in our district adopting proclamations or issuing proclamations to encourage businesses to reopen. It was met when they were introduced in the 2 cities that I'm aware of. They were met with a lot of concerns about it being partisan, and I have to agree with those concerns. The the governor is not a mean, evil guy trying to kill all these businesses for whatever reason. Um, and I understand that city councils need to make the best decisions for their communities, but having a proclamation be, quickly thrown on the docket one day with little to no notice doesn't allow the public to really digest that, doesn't allow folks to formulate a good response to it and really think it out. The other thing is it's so political. As we've mentioned in the Stay Safe Minnesota order, there are phases of reopening. There are things happening. It's moving. So to just kind of get on board and make a proclamation that on something that's already happening, to me is very politically motivated, and I hate to see that. I really, really hate to see any city council, any municipality, county, any elected official really make kind of a mountain out of a molehill and politicize something that doesn't need to be. So there's a few out there. That's a decision that they made, and it's kind of a moot point at this point because the state has made some decisions that are kind of in line with what those proclamations say. So it didn't really do anything but raise some eyebrows. So that's all I'm going to say on that. All right, so for this next part, we are going to move into discussing mental health. It's one of my biggest, most focused issues on my platform. I'm very, very passionate about this particular issue. That being said, I do just want to give a trigger warning that we are going to discuss things like suicide, mental health issues, that kind of thing. So if that's a concern, just know that we are going to be discussing those. So I want to start with a quote that I heard from a therapist I was watching online. The term mental health has been equated with mental health issues, but instead of just mental fixes, we should be thinking about mental fitness. We don't have to be broken. We don't have to be desperate. We just have to be curious and ready to level up and move closer to the version of yourself that you want to be. So keep that frame in mind. And some fun facts, not so fun facts, I should say, is Minnesota is one of the worst in the nation for student to counselor ratios. I wasn't aware of this, a couple years ago, and I have been made aware of it through community events and a lot of door knocking. We heard a lot of concern with bullying. I talked with a really nice gentleman in Watertown who had just moved from a kind of more central suburb, not in this district, had moved out here because his son was being so bullied in that school and there was nothing they could do about it. So they pulled him out of the school, moved out here, and were hoping for less bullying out here. We've heard time and time again of the racist incidents within our Eastern Carver County schools and bullying and that kind of thing. And there should be counselors there to address that. In an ideal world, no student would have to wait to get their mental health needs addressed, and we could have counselors in every school ready to help with any warning signs that they might see. Right now, we don't have that, and that's just so upsetting. As a community member and as people who have kids have told me they need to see that happen. Right now, there is no comprehensive focus in our courts. So there's, you can order a mental health evaluation in the courts, but there's not a real comprehensive way of attacking these problems. So when I was a law student, I worked for a judge in Ramsey County. A wonderful guy, very, very compassionate. But it was really his courtroom, and he made these decisions to, order mental health services as part of the sentences, and that was his courtroom. That's what he decided to do. I would like to see a more comprehensive plan of attack. So, some people that are committing crimes, I would argue a lot, if not most people that are committing crimes, have some type of mental thing that needs to be addressed as part of their sentencing. It's been, shown time and time again that if there are mental health or counseling services in correctional facilities or in treatment facilities, those offenders are less likely to reoffend and wind back up in jail again. So I would, like to see that bump up. Opioid addiction is a really serious issue in our entire country and in the state. There's a more focused effort on getting mental health needs addressed in that type of area. Still could use a lot more funding. Representative Cagle had a bill this year to allow an increased funding. It's a little more techy than that, but I won't get into it. That did not, that part of it passed and part of it did not. So there's efforts. They just need to be taken a little bit more seriously. I work with veterans in both of my jobs, in my bartending job and in my job at the state legislature. And veterans that are younger, veterans that are older. One thing that is really consistent in their beliefs is, and their experience, is they've all lost people, veterans that they've fought beside or trained beside, to suicide. So there's a company that makes clothing. It's 20 a day. So that means 20 veterans are committing suicide per day in this country. That number is also going to be joined very quickly by farmers in our district. We've got a lot of the small farmers that need a little bit more assistance and a little bit more help. So both, the Department of Agriculture and the Department of Veteran Affairs should have more funding to address those issues. There's just simply not enough attention being put on them. There's simply not enough funding being put behind them so they can do what they need to do to help address those very, very serious issues. Rural areas. So this is a fact I looked up on NAMI. I will actually post this later. If one of my team members could remind me, there's a NAMI data spreadsheet, fact sheet. 1,999,105 Minnesotans live in a mental health professional shortage area. So even if you have, you have some issues, you want to go see a therapist, you might have to drive 20, 40, 50, 100 miles to get to someone that can help treat you. Part of my platform is expanding mental health services into those rural areas, so it's not so difficult to reach. It's part of a bigger plan. So I talked about the guy in Watertown that I spoke with about his son. I have some kind of more personal stories as well. I'll start with a guy that I talked with in Dahlgren. He was my last door knock of the day 2 years ago, and it was hot, and I was sweaty. It was like last one. I've been driving farm to farm and campaigning for another candidate, and I pulled up to this farm, and I was looking actually for this guy's wife, but she wasn't home, or she was cooking dinner or something. So he was fixing his tractor, and it like sun's setting, and he's struggling to like fix his tractor and get inside. I'm like, he's not gonna want to talk to me. And I walked up, and we had the best. I mean, I stayed there for 20 minutes. We had the best conversation. His second wife, who he was married to then, had a son that got in a lot of trouble in California and had moved home, lost his driver's license, that kind of thing. And talking with him about the mental health struggles of his stepson, and the family dealing with his struggles. There was a little bit of drug addiction in there, alcohol addiction as well, and just seeing how committed this man was to his stepson and getting him well and getting him healthy. It really moved me. And it's just another example of how, it's another example of how, our community steps in when they need to. We're so family oriented out here, and I know my family, the folks that have struggled with mental health in my family, we've done the same thing, just surrounded them, stepped up and helped and did what we could. So there's a lot of organizations out there that are trying to do the same thing that I'm talking about, expand these services, get people more access and quicker access. There's just simply not enough. And we all know someone who struggles with mental health. I would also make the argument that most folks should see a therapist. I see a therapist every week. And, even there's weeks where I'm like, I'm fine. Nothing's wrong. I don't have anything to talk to her about today. But that quote that I read you earlier, thinking about it as mental fitness. So you're practicing your health. It's the same thing as exercising. It's going to set us all up for success in the future, or easier success, ability to bounce back from issues, or, downturns, ability to have healthier relationships, that kind of thing. So I think there needs to be a couple different things that happen. And part of the reason that I'm so passionate about this, and it's one of my biggest issues that I am going to pursue when I get to the legislature, is there's a couple different things we need to get done. First is we need to destigmatize it. So the legislature can't control a culture. We can't change how people think. But there are programs that I've seen get funding for marketing. So, destigmatizing it via a plan to help educate people on warning signs for suicide or a mental health crisis, or spread the word about these free or less expensive services that are available in each county. Carver County has a great mental health helpline. And we do have a treatment facility that was built in 2019, I think 2019 as well. But expanding the knowledge and about those services. So we can definitely do some marketing via our legislative avenues for that. I would like to see a huge increase in funding broken up into these different areas. So funding for counselors in schools, expansion into rural areas, creation of social workers on police forces. So this was not an idea of mine. It's an idea that I've heard about and adopted into this platform because I truly believe it will be successful. Having social workers on police forces. So currently, if there's some type of issue, someone gets called out, police get called out to someone's home or wherever they are, and there's some type of mental health issue, there's not generally a social worker on the scene with them. So they, who are not trained in, extensively, of course, they've got all of the law enforcement training that is required and necessary, but not trained as a psychologist or a social worker, are having to make a decision to put that person in an ambulance and send them to a hospital for a psych eval. That is expensive for that person. Ambulance rides are very expensive. And then it's expensive for the hospital to conduct that evaluation. And then that time that it takes to get from the scene of the incident to a hospital, that person may have kind of recovered or removed themselves from the situation. Either physically removing them from that situation has diffused the tension, or they're just no longer in that crisis by the time they get there. So then they're released. Then, they go back right into the situation they were in before and may require another police visit. So a lot of that's a very expensive procedure. That could be avoided if you sent a social worker out on these emergency calls with the law enforcement. Not only do they have the training to know, this person, for example, is autistic, or it looks like they may be autistic, is behaving that way, so they probably don't want to be touched. So we can handle it, this way or that way. And then, having the ability to make that decision to send them to the hospital or not is made by someone with a little bit more tools in the toolbox to make that decision. I'll say it that way. So if we could create some type of fund to allow those positions to be created on law enforcement with police forces, that would be a really tax-saving measure and a life-saving measure, in my opinion. I worked with Representative Lori Pryor from Minnetonka on a bill to allow more private practices on college campuses. So on a backstory on this one, I have a really personal connection with someone who went to St. Olaf and struggled really, really bad with mental health and had to eventually withdraw from this great school with this great track record. Part of the reason they had to do that is there was this person reached out for help, and help was not available for several weeks. And then this spiral was already happening, and so they kind of went on this big downturn and weren't able to get the help that they needed at the time that they needed. And that story is not one of a kind. That's a frequent thing that happens on these campuses because there's so many students and not enough counselors to help them out. So if the bill would have allowed private practices to come onto campuses, so it's like a win-win. That private practice gets to, have their business there and treat students. The students have easy access to a really good counselor, and medical and academic records are never being mixed. So there's a little bit more data protection there. I would like to see that expanded. So I plan to pursue that a little more when I am elected this November. I would like to see us, or the state legislature, encourage collaborative courts. So when someone is being sentenced, you get the judge, you get the lawyers, the prosecutor, defense attorney, and you have their social worker, their probation officer, maybe a therapist, psychologist, something of that sort, to get together and say, okay, does this person have, whatever mental illness? Does this person have an addiction disorder? What do they need? What's going to help them in order for them not to commit crimes? That's going to be saving us money by keeping people out of prison. it's going to save lives too. So I would really, that's been extensively studied and proven to work. There's drug courts in a lot of states. Missouri was where I went to college, and they had a drug court too. So someone who had a drug offense was automatically enrolled in this type of treatment, and it significantly reduced the numbers of recidivism, so or reoffending. The Department of Veteran Affairs has a suicide office, and I believe Representative Eklund carried a bill this year to fund that a little bit more, a lot bit more. I don't believe it passed. I'll have to double check on that. That is automatically something I would sign on to, absolutely, if not carry myself. That being that it's Memorial Day tomorrow, and we're remembering, our fallen officers, or fallen, military members. One of the best things we could do to help honor them is to fund this. I was watching a TED Talk the other day about veteran suicides are numbering 21 that are killed here at home to every one that is killed in battle across, in whatever country they're in. That's got to change. I mean, plain and simple, that has got to change. We'll have another veteran video where I get a little bit more in detail about that, but funding the Department of Veteran Affairs Suicide Office would be a great place to start. There's a lot more we could do, but that would be a great place to start. And then last, I would like to see, second to last, there was a bill that Representative Poppy carried and actually got passed this year with the significant increase in concern over farmers' mental health in light of the COVID crisis. Especially now we're seeing, hog farmers having to slaughter 60,000 hogs, because there is no market to sell them at this point. On top of how difficult it is to be a small farmer now anyway, in this day and age, the Department of Agriculture did receive some funding to address those issues, and I would like to see that continue as well. Talking with my friend who works for the Agriculture Committee, he said it's one of the most depressing committees because it's so difficult to be a farmer anyway. And then on top of it, you have all this, kind of stigma around mental health, and it's one of the communities that's struggling the hardest with it. So it's kind of like you can't ever do enough. So I hope to change that a little bit. So the last thing I'll say about that is coverage under health plans. No one should be, I talk with people all the time that, I would see a therapist or my kid would see a therapist, but it's so expensive. Nobody should be turned away from seeking and receiving mental health treatment because of cost. It should not be cost prohibitive. There are sliding scale company or organizations, therapy offices with a sliding scale, but that's not quite enough. We need to expand these community mental health programs so no one is turned away because they can't pay for it. Mental health is so vitally important, and if we have that in place, we're not only are we saving ourselves, we're saving our communities, but we're saving money as well. If we're preventing crimes from happening, we're preventing imprisonment, we're preventing 72-hour holds that cost $2,000 a day at a hospital when there's not that many beds anyway. It's overall just a good policy. So there was something like 400 bills relating to or mentioning mental health in the legislature this year. Not many passed. So I think it's a we talk about health care all the time. We don't necessarily also include mental health in that. So I will also give a shout out to Dan Kessler, who is running on the 47B side against Representative Bowe. He is a mental health professional for a living. And if you haven't heard his speeches, a lot of it has to do with the reason why he's running. A lot of it has to do with the struggles that he's seen as a result of politics and wanting to do something about it. And there are 2 doctors in the House right now, same thing. And there's one, 2, but will be one next year in the Senate that are trying to pursue the same thing. So I'm not, being here claiming to be a therapist or a mental health professional in any way, shape, or form, but those folks that are going to be in the legislature, and that's, my whole thing is surrounding yourself with really smart people. Those are the people that I choose to listen to. Done a lot of research on this topic, but I would definitely support, there was a couple Representative Kelly Morrison's bills that I would have signed on to in a heartbeat. Representative Mann, same thing. There's definitely a lot more that can be done in order to really help a lot of folks. So a couple things I'll leave you guys with. If there's no questions, if you have questions, put them in the comments. I'm happy to go off track and answer them. So last thing I'll say about the mental health thing, what you can do right now. We're all struggling right now. Like I even had a really hard week, I'll admit it. It's a tough, we're in a pandemic. The stress and the anxiety is so much higher than normal, and that's okay. You talk about it in different ways, and there's different ways of coping. So I'll just share with you kind of what's helping me and what's helping some of our community members that I've spoken with too. Again, I go to therapy every week. Highly recommend that. There are therapy apps now. So if you're not comfortable being on the phone or being in a virtual meeting with someone and you want to text, there's Talkspace, BetterHelp. There's different apps that are available to you. So I encourage you to check those out and spread the word about these as well. Getting outside, exercising, huge boost to the mental health. I think I posted yesterday or today about paddleboarding. I love it. Getting outside it does wonders for you. There are several free meditation apps. I have, I think, like 4 on my phone. I have Calm. That's the only one that's coming to mind right now. But yeah, search meditation apps on your phone. There's several that can help you get into that practice. Reaching out to loved ones. Right now, we're so isolated. Even if we're connected like socially, we're still very isolated, and therapists are seeing a lot of detriment as a result of that. So, give your loved ones a call, give them a FaceTime, a Zoom call, do something fun, like watch the same movie at the same time, or like color together, whatever it might be, just so you have that kind of connection, even if it's virtual for now. Educate yourself on the warning signs. Right now, there's certain groups and companies that are trying to educate the public on warning signs for a mental health crisis, any suicide, any depression, anything like that. Take the time to learn those warning signs so you can keep a lookout for your friends and your family and your community. And donate to mental health organizations. Like I mentioned, those, few that are trying to help and spread the word and advocate, at the state and federal level for better mental health legislation. Donate to those as well. All right, so with that, again, I will, as I say every week, if you have questions, comments, I've learned a lot from everyone watching these videos and sending me emails. I said this thing and they have a comment about that, and then that is how platforms are really made and fleshed out. So if you have a question, comment, let me know. Twitter DM, Instagram DM, Facebook message, email, text, phone call, website. Okay. And if you have other topics that you want me to cover, we've got a couple on the horizon. I've got agriculture, healthcare, education, veterans affairs or issues. Anything you want me to talk about or want to know my platform on, let me know. I'm happy to dedicate one of these town halls to that. And then questions, like one-off questions, are super fun for me to answer. So I like that kind of popcorn thing. So if you guys want to shoot those to me via email earlier, you can do that throughout the week. That's how most of ours have come in today. And then if you have any questions while you're on here, just leave those in the comments and I can answer those as well. Actually, this time next week, we will know who my opponent is too. So that will be very exciting. All right. Endorsements. We have a page up on the website now. So right now we are still collecting, endorsements from different groups, agencies, organizations, that kind of thing, that I'm really excited to work with. And I'll announce those as they come in. We are still collecting community endorsements. So if you know someone or you want to endorse this campaign, awesome. That's so great. And you can do that on the website. So there's a spot on the website you can type your quote, name, picture. I don't know if video's allowed, but might be. But you can definitely upload a picture, and we'll announce those a little bit later on in the campaign. But keep those coming in. That's really great, and that's, I can sit up here and say I have the best ideas, all I want, but it doesn't mean anything if the community's not behind this campaign and saying the same thing. Yeah, she's got really great ideas and she's gonna get this done. And so those are more meaningful than anything that I could ever say. So thank you, and please keep those rolling in. Mention the lawn sign. We'll take your lawn sign locations on the website as well. And if you have any trouble finding that stuff, just shoot me an email, text, whatever. We can help you find that. Last thing, as always, is the volunteer plea. We can't do this alone. We need everybody to pitch in. There's going to be a lot of craziness, a lot of partisan stuff, nonsense, shenanigans that are going to go on this year, especially with the presidential race. We are a battleground state this year. So we'll see a lot of stuff we probably don't want to see. Everybody's going to get sick of politics by the end of the cycle here. So the earlier you can help us, the better. And especially while you're at home looking for things to do, text your friends, call your friends and neighbors, and we can get you a list to call and text as well from us. So if you have the time, you have the capacity, and you want this done, if you want this district won by this campaign, you got to pitch in. You got to help us out. And I really, truly appreciate it because I can't make all these phone calls myself. And they're fun. It's a lot of fun to talk to your community members. I learn things every day. I learn different issues and, fun tidbits of information. So you could do that too. So join us. Let us know. And then the last thing too, I will say is if you are in a place where you have funds, your financial setup has not been affected by COVID, and you are comfortable in donating, we do have the PCR program still going on, and that's been really helpful. If you are at a place where you can donate $50 or more, you want to donate $100, add 50 on top of it, you can get that 50 back from the state in a matter of weeks. Even less now. Mine came really quick when I filed mine. So has nothing to do with taxes. It's like a magical program. Don't ask me how it works because it's just awesome. But if you're a Minnesota resident, you're registered to vote, you can get $50 back from the state or $100 for a married couple with a receipt that we will send you when we send our thank you notes as well. So please keep those coming in. This is about to be a very expensive election. I am going to be facing a lot of outside money. The more research that our team does into outside money coming into this district, the scarier it is. There's going to be a lot of influences that don't belong here, that aren't from here, that don't belong here in our politics. So I'm not taking money from corporations. I'm not taking like secret PAC money and like dark money and all that stuff. There's a limit to how much lobbyist money I can take. To date, I believe I've only taken 50 from my cousin or 100 from my cousin, who is a lobbyist in DC. He donated because he's my cousin, not because he's a lobbyist. But, we need to keep this a grassroots effort. So that means small dollar grassroots donations. So please keep those coming in if you can. We really appreciate it. And we are going to need every cent to battle the dark money that's going to be coming into this district from outside forces. But we can do it. We can beat them. All right. So if you guys don't have any more questions, I'll wake my dog up and see if he'll come in here for a minute. Hey, Chips, come here. Come on. Oh, I know it's tough. Come on, right here. Here you go. Right here. Sit. Thank you. Okie dokie. That's my boy. He's looking a little sleepy. He wants to go outside and run. Yeah, for those curious, he's a 5-year-old Gordon setter from Rice Creek Kennels up north, and he was trained right here in Watertown. So I highly recommend the Wings and Whistles dog training in Watertown. He's an angel because of them. So thank you, Schulenbergs, for that. All right. Thank you all for tuning in. I really, really appreciate it. Again, any questions, comments, let me know. I'm all ears, and I want to hear how you guys are doing too. Keep sharing this video, spread the word, share, every post if you can. Just really flood the airwaves with this stuff. And I will speak with you guys a week from today. Go out and enjoy the day, and we'll talk to you later.